Hey everybody, I'm Howard, and this is Otter's Retirement Corner. Alright, so today I'm going to bring up a very controversial topic. I'm sure this will get a lot of comments, and I want to see that. I want to see discussions. Certainly tell me what you think. I know you'll tell me what you think. For today, why would single-payer healthcare, or what's commonly referred to as Medicare for all, be a good idea? Or is it a good idea? Or is it a bad idea? And I'm not here to decide that. I'm here to discuss some issues, maybe talk about things that politicians look at, or specialists in the field look at, to sort of make these determinations. And of course, it's a political decision more than anything else, because any change in healthcare laws would have to come through Congress. So, that's going to put a damper on most changes, because it's hard to agree on anything. But let's take a quick look at this. And we talked about a little bit this in the last videos. We talked about healthcare costs for senior citizens, or people on Medicare, or retirees, whatever you want to call us. The average cost for those people on Medicare, could be $5,000, $6,000, $7,000 a year for premiums and healthcare expenses, depending upon who you believe or who you listen to. Overall, and I made this point in the last video, healthcare spending is now, approaching $5 trillion a year in the U.S. Not there yet, but approaching there. And over $14,000 per person for every one of the 330 million plus people in the country. So the first thing you have to understand is that $4.9 trillion is getting spent now. That's already there. It's not like we're going to avoid that, or if we avoid Medicare for all or single payer healthcare or government healthcare, that we're going to get rid of those, we're going to add costs. Those costs are already there. All right, so the first question is, why would you do this? Why would a single payer government health plan be a good idea? Three right off the bat facts. First of all, it's going to reduce that overall cost. That 4.9 trillion would come down. It eliminates certain costs that are already in the system. One of those would be for-profit and not-for-profit healthcare insurance company operating costs and their profits. And it would lower reimbursement rates. So right now, private insurance has one reimbursement rate. Medicare has a much lower reimbursement rate. You would go to a rate that closer to a rate that Medicare is paying. There may be some circumstances or services where you have to go higher than Medicare. But in either case, you chop off all those operating costs, all those profit costs, and all those negotiated higher rates of private insurance companies. And as we talked about last time, private insurance companies add costs to healthcare in the country. That's just a fact. So, number one, it reduces costs. Number two, it covers everybody. Depending upon who you want to listen to right now, there's about 40 million people who have no healthcare coverage at all. There may be another 40 to 45 million who have inadequate insurance or no access to health care in one way or the other, even though they may have some simplified insurance plan. So it gets everyone covered. And whether you believe insurance is a right or a privilege, the fact is that if we had health care for all, everyone would be covered. Anyone who gets sick can go to a doctor. Anyone who's gravely injured can go to a emergency room. No one would be denied service, and service would be paid for. Well, we'll get a little more into that. And this is going to take a second video, so we'll cover that later. And finally, it saves lives. And this is a statistic from the National Institutes of Health, and it would purportedly save 1.73 million life years every year. So, it's just a statistic to say people would live longer because they would now have access to health care, and chronic diseases wouldn't be killing people as quickly or as easily or as often or as commonly. So, three main goals that I don't think we would argue about are good goals. We may argue about how we get there, or if it's worth it getting there. That's up to your own personal interest, I guess. So, who pays that 4.9 trillion now? Because it's getting paid. Whether you see it or feel it or understand it or hear it or not, it's getting paid right now. When you look at senior citizens or people on Medicare, we're paying with our Medicare premiums, 174, or if we have IRMA, we're paying much more. We pay deductibles or co-pays depending upon what kind of plan we're on, or if we have Medicare Advantage, we have those private healthcare insurance premiums or not. There's Part D where you may be paying extra premiums. That's what seniors pay. That's part of their $5,000 to $6,000 a year in healthcare costs. Covered workers is the biggest group. While you're working and you have insurance with a company, and not everybody does, and maybe 50–60% of us workers are covered. So you're paying insurance premiums. You're also paying co-pays. You're paying deductibles. Everything that we're all used to paying and seeing every year. There's also no, you can't be in the video. Go back there if you want to be in the video. Government. Right now, Medicare is running at a loss, so they're spending more than they bring in. That's coming out of the trust fund right now. You can call that government spending. It's taxes that have been put in the trust fund that weren't used in the past that are now being used. So money's coming out of there. And then Medicaid. The federal government spends about $600 billion a year on Medicaid. It's shared with the states. And we're not going to get into the state role because then, you have to figure out state by state what they would do. So let's just forget about that for now. And then corporations. That healthcare insurance you buy through your company is being subsidized by your employer. Now, the last company I worked at, they swore they were paying 80% of our premiums. We actually got a statement every year that said, hey, this is how much the company's paying in your insurance premiums. See, we're paying 80%. Okay. So if you're paying $200 a month or $400 a month or whatever it is, that's just a small fraction. Maybe the company's paying $1,000 a month or $12 or $15 or $2,000 a month. You have a really great plan of your health insurance. So it's something you don't see, but it's there, and it's a huge portion of what's being paid for healthcare coverage, for healthcare and healthcare coverage. There's also various donations that come in, charitable organizations that pay for healthcare services throughout the country, both on a state and a local level. There's some federal programs, but that's how you divide up all that money that's being paid now. So whether you see it coming out of your pocket or not, or someone else's pocket, it's coming out. That 4.9 trillion is there. As we look at these expenditures and we look at individuals, understand that the burden skews towards lower earners as a percentage of what they earn. So, you have two people working at the same company. One makes $50,000, one makes $200,000, and they both have the same insurance policy and they pay the same premium. They have the same deductible. They have the same copay. The same max out of pocket, which is designated by law through the ACA. Whatever they're paying is going to be the same for the same services through that insurance plan. But because one person makes $200,000, they may spend $15,000 a year for all that, and that's a much smaller percentage than the person earning $50,000, who in essence is paying 30% of their salary for healthcare. And don't shirk at that $15,000 number because it happens. I just want to take a quick look at a couple earning. I don't want to make this complicated, but take a couple earning $120,000. For their premiums and Medicare taxes, they may be paying $8,000 a year. You can say 6, 7, 8, 9, 10. I'm just going to use 8. I'm going to throw that number out there. Co-pays and deductibles, now max out of pocket would be $18,900 a year. So they could add an additional $18,900 a year. But if we take it at the midpoint, when you add that $8,000 in premiums and taxes and then they're out of pocket, you're looking at about $17,450 a year that this two-person couple will spend on health care, or almost 15% of their salary, about 14.5%. So healthcare for all, Medicare for all, government paid healthcare would eliminate all that, okay? So forget all those sources I talked about where that money's coming from, that would no longer be the case. And what would happen is all those payments would shift to taxation. So the first thing people scream about when you talk about single payer healthcare is, oh, the taxes would just skyrocket. Well, yeah, taxes would go up, but you would no longer be paying this. So take that couple that's paying at a midpoint $17,000 a year, might be $20,000, might be more. If you said to them, instead of that, you're going to pay $15,000 a year more in income taxes. And the first thing people yell, I don't want to pay $15,000. Well, you've eliminated $17,000, so there could be a savings for you. So, and this is where it gets really complicated. The way you lay out, and Bernie Sanders and Elizabeth Warren had a plan years ago that got completely ignored as to how to pay for this. And we're going to talk about that a little bit in the next video. But understand, all this program does is shifts where the money comes from. And we have to decide if this is something we want, how do we shift that burden? Who pays more for healthcare than they're paying now? Who pays less? Who doesn't pay at all? That's going to happen. There's already people who pay nothing. People who don't work and don't pay taxes, they don't pay anything for healthcare. If they walk in as self-pay to a hospital emergency room and they get treated and walk out, they'll get a bill, but they won't pay it, and the hospitals will write it off. So, what do you think? Who should pay for this? Should it be done? Is it a good idea? Is it a horrible idea? And if it's a horrible idea, why? All right? I'm not saying it's a good idea or a horrible idea. I'm asking you, it's something we're going to discuss in at least one more video. It may stretch out to two. I don't want to do these too long. But tell me what you think. And then please subscribe. Please like. Please comment. Let's have some cool conversations about healthcare, government-sponsored, Medicare for all, single payer, and let's keep it nice. I know it's going to get people angry, but that's okay. Just tell me what you think. Thanks, and we'll see you next time. Bye.